Eh bien, si par exemple, promet tout, nous prenons nos petits interviews aujourd'hui là bon matin et nous avons un grand plaisir pour Monsieur Prithivi Mohandas qui est Managing Director MIOT International India avec nous ici là bon matin pour cause plus les autres travail, les autres facilités et tout ça là. Good morning, doctor. How are you doing?
I'm very well, thank you.
Okay, let's try this. Sorry.
Hi, I'm very well, thank you.
Okay, so we are very happy to have you here with us today for the second time.
Yes, it is. It's my pleasure.
All right, thank you. So, Dr. Prithivi, can you please introduce yourself before we proceed?
All right, well, I'm from South India, from a city called Madras. It's now called Chennai. It's got 9 million people. And yes, I'm a doctor, but I also run the hospital called MIOT, which is now 25 years old. And it has 1,000 beds and 3,000 employees.
Wow, 1,000 beds and 3,000 employees.
Yeah.
They are all from India.
Well, we've got MIOTs in various geographies.
Okay.
So the total strength of the employees is 3,000. Around 2,000 of those are in Chennai, in India.
Okay. All right. So MIOT has reached a milestone of completing 25 years of integrity in healthcare.
True.
So how has the response been from the Seychellois community since the inauguration of MIOT?
Well, I think that the relationship with the people of Seychelles extends over the last 14 years. And we have a very close bond, not just with the Ministry of Health, but in general with various people whose lives we have touched over the last 10 to 14 years. So the relationship continues and the response is overwhelming.
That's really nice. So what sets MIOT International apart from private health facilities in Seychelles? And how do you ensure the highest quality of care for your patients?
Well, I think the first move to ensure quality of care is to have people who care. And whether it's a doctor or a nurse or it's a technical person, MIOT's rule is that you can't work anywhere else. You have to be full-time. And the focus is patient care rather than just making money.
Exactly. So talking about money, can you tell us a little bit about your fees, the prices of your...
Sure. I think that we have always been very keen to ensure that patients get a fair deal so that they have accessibility and whatever is offered is affordable. The last time I came on the show, we were talking about the new X-ray unit at MIOT, where the patients had the X-ray as well as the report and the actual film on a USB stick for just 200 Seychellois rupees, and that definitely for an X-ray in Seychelles is pretty reasonable.
Exactly, it is very, very reasonable. So you have recently introduced the master health checkups by MIOT's experts in Seychelles. Can you tell us more about it? I can see you have the general master health checkup for men, general master health checkup for women, cardiac master health checkup for men. Tell us a little bit more about those treatments.
Of course, I think that the people of Seychelles are very keen to know whether they are healthy. There's a lot of awareness now in Seychelles focusing on prevention rather than waiting too late. And we've basically decided that because there is this demand, there is this requirement that we should introduce accurate, modern, not just gadgets, but also consultations, so that anything that the patient has is picked up early and can result in cure and not just chronic suffering.
Yeah. All right. So very interesting. MIOT. Do you? What type of patient do you usually get at MIOT India?
Well, MIOT is a quaternary care hospital. That means we don't get people with coughs and colds. We tend to get people who have complex disease, and that means diseases either that have been attempted to treat earlier and treatment has failed, or a patient who has a difficult disease that people just find difficult to find a cure for. And so a lot of these diseases not only require modern technology, but they also require a multidisciplinary approach, what we call collaborative care. You can't have multidisciplinary approach if you have staff who are visiting. So we don't have traveling salesmen. All our staff are full-time, and therefore they work as a team. And the ethos of MIOT is to make sure that the patient comes first before anything else.
Exactly. In the past 25 years, what key lessons and insights has MIOT gained that have shaped its approach to healthcare?
One of the most important things is to make healthcare accessible and affordable. The price of healthcare has become astronomical. Healthcare technology sometimes has been progressing for progression's sake and not for the patient's sake. And I think we have to find an equilibrium between delivering cutting-edge care, modern treatments, but all of this at an affordable cost.
Okay. We had a chance to chat about the direct flight situation right now after the COVID-19.
Sure.
All right. So, what are some of the challenges that MIOT has faced over the years, and how have they been overcome?
I think one of the great things about COVID-19 is to bring the doctor closer to the patient, to bring the technology closer to the patient. So, and this is a blessing in disguise, because owing to COVID, we started off with A to Z of eye care in Seychelles, so patients didn't have to travel. Then we moved it to ENT. We've moved it to general pediatric surgery. And now, we've got this amazing new master health checkup and telemedicine facility, which is not just video calling, but really connecting technology and the doctor in real time to the patient.
Okay. So we also got a chance to talk about, I won't be mentioning names, but you have some successful stories from clients, patients from Seychelles.
Yeah.
Can you tell us?
Well, I think there is obviously a scenario of patient confidentiality,
Exactly.
and you're absolutely right. We won't be going into names, but yes, Seychelles is a country of 100,000 people, so it is inevitable when you're treating people from Seychelles over 14 years that you'll stumble across the odd person who's become Miss Seychelles, or a person of importance politically, or in sport, or in the entertainment industry. And yes, you're very right. One of the songs I've requested you to play is somebody whom I have a great regard for, who has a beautiful voice and is a beautiful person.
Okay, so we'll be listening the song that you have requested from one of your patients from Seychelles.
Yeah, I didn't say that.
No. No, you didn't, exactly. You didn't, I did. So, nous vous prenons une petite pause musicale. Et bien, si pour aucune question, s'il vous plaît, venez devant. Et l'honneur pour Dr. Prithivi Mohandas, qui est Managing Director of MIOT International India, là avec moi. Bon, c'est vraiment, moi, dire, les grands monde qui là avec moi dans le studio. Bien, si, I think you're one of the best doctors over the world.
Me? I think the last.
You agree?
Well, I think a last thing any half decent doctor would do would be to blow his own trumpet. Right now, really, my task is to try to manage this gigantic organization called MIOT. And really, the enjoyable area of my work is facing these exciting challenges, like making an equilibrium between the cost of healthcare and the quality of healthcare, so that patients can access and afford it.
Indeed. Alors, c'est bien si, par exemple, si on envoie une petite question to Dr. Prithivi Mohandas, c'est mon question, D55, DD55, 442, 42, 42, et aussi le nous application par oublier, le nous WhatsApp, quelle question, si envie peut-être bonne advice ou peut ou envie connaître si ou situation la santé est capable aussi aider là-bas dans autres healthcare facility en India. Bien sûr, capable de poser nos questions. Il a aujourd'hui pour répondre aux bonnes questions. Et nous n'avons pas beaucoup de temps ensemble. Alors, profitez là comme il a même. Envoyez une question de DD55 442 42 42. Aussi de nos applications et de nos WhatsApp. And doctor, we have some questions.
Absolutely.
So Nelda she complimented MIOT.
Right.
She said MIOT is the best hospital here so far. Hats to them.
Merci.
Okay, merci. So Nelda, merci from a doctor. So good morning, Queenie. Good morning. Please ask doctor if there is any treatment in provision of someone with a retinitis.
Pigmentosa.
Pigments, yeah. Since there is no cure so far. This is from Sarah.
Well, usually this is a condition that is a chronic condition. It's not a self-limiting condition. So yes, you would need regular checkups to control the progression of disease. And there is life for people with retinitis pigmentosa. You need to have a good rehab unit that teaches you to continue and handle your day-to-day activities despite the impairment. So yes, I think you should contact Lisa Chetty at the Espas building at MIOT, and she'll give your life back to you.
Good. So we'll be talking about Espas MIOT in a few. But before that, there is another question. What is the price for knee replacement?
Yes, we had a little chuckle about this. We were wondering what's the price for husband replacement. But with regard to knees, really it depends on the implant you choose. I mean, you could go with a very basic implant made of plastic that would cost you $1,000, but probably will only last for 5 years. Or you could go to a computer navigated robotic custom implant made of chrome cobalt or titanium with special vitamin E polyethylene that lasts you 30 years.
30 years.
Yeah, 30, but the implant would cost you $3,000. So it really depends on the demand from the patient. Is it a young patient? Is it an active patient? Is it a sporty patient? So it depends on, so you could either get yourself a Honda or a Ferrari. It's up to you.
So can you have the knee replacement here in Seychelles?
Of course.
Okay.
Yeah, I think that the Ministry of Health offers knee replacements, and they do it very successfully and very well, and they've been doing this for some time. So yes, you could have it done in the Seychelles. Why not?
All right, doctor. That's a very good one. So talking about the Espas MIOT, what are the new areas, what are the new treatments that you will be offering in the near future? Also in India, the MIOT India and Espas MIOT.
With regard to the Espas building where MIOT Seychelles is located, we started off with ophthalmology with eyes. We went on to ENT, which is ear, nose and throat, and we offer all the surgeries. These are day surgeries. You have it done in the morning, you go home in the afternoon. We offer master health checkup. We offer cutting edge real-time telemedicine, not just video calls. But when you're asking about what are the new offerings, I think it's pediatric general surgery and a very exciting area that we haven't really detailed before, which is psychiatry, especially autism and addiction.
Okay, that's good. So are we talking about 2 years, 3 years, 5 years?
So all this is ongoing at the Espas building. If you're talking what's going to happen in 2 years' time, as I've said before many times in Seychelles, we'll be leaning towards cardiac and cancer. But if you look at Chennai, India, and you're asking about what is exciting, there are some amazing new exciting developments that have taken place to improve the safety of the patient when they have extensive surgery, like very difficult cancer surgery. There's now the Da Vinci XI robot, which MIOT will soon be using to make cancer surgery very quick, very safe, and recovery also less cumbersome for the patient. This is an exciting area to look at. Also some very, very good robotics and navigation in neurosurgery that makes the surgery on the brain less difficult and recovery faster for the patient with less complications. And of course, we recently rolled out the CT scanner inside the operating theater. So while you're operating, CTs are being done of the area you're operating, so that you don't operate on something that's not a cancer. And if you're going to remove it, you remove all of the cancer without damaging normal tissue. So intraoperative CT is another, a great advancement in technology.
Yeah, it is wonderful. So how does MIOT plan to continue expanding its reach and impact in the years to come?
Well, I think that our aim is to go to places that really need certain areas of development in healthcare. For example, in the Pacific island of Fiji, we are the only entity in the country of Fiji to offer open heart surgery for the citizens of Fiji. And Fiji from India is an 18-hour journey. So we have MIOT in Fiji that operates on patients. It's around a 1 million population, and anybody who needs heart surgery, MIOT performs heart surgery. So similarly, we select areas that are required. We don't want to reinvent the wheel. So if Seychelles already has certain areas that are covered, those are not the areas that we're going to go into.
Yeah, exactly.
Yeah, the areas where there's a little bit of gaps are the areas that we're looking at. And one of the great satisfactory areas to look at is treatment for heart ailments. And that's something we're going to focus on in the future in Seychelles.
Okay. So Dr. Prithivi Mohandas, we have reached the end of our interview. Do you have anything you would like to say before we end our conversation for today?
Well, I think there's a lot to look forward to in Seychelles, a lot of hope. And there's a really, people in Seychelles should be having a very positive look about the healthcare scenario in their country, because there are people like MIOT who are very keen to partner and develop facilities that are genuinely required within Seychelles.
Okay. So, Dr. Prithivi, it was an honor to have you here with us today.
Thank you.
It was a pleasure having you. So, hopefully, we'll be interviewing you again.
Definitely, definitely.
All right. So, thank you. And all the best for MIOT, MIOT India and MIOT Seychelles.
Thanks for having me.
Exactly. So, thank you pour qui n'écoute nous et merci beaucoup pour qui nous envoie une petite question. Et nous sommes capables de causer avec Dr. Prithivi encore plus de temps, mais malheureusement, le temps qui pas de nous faveur. Mais tout de même, pour vous qui envie, bien sûr, gagner plus d'informations, m'assurer qui est capable aussi de gagner d'autres détails. Pour appointment, I don't know numéro téléphone. I will be giving the phone number for the appointments at MIOT Seychelles Medical Health Center. Vous pouvez contacter les autres le 432 66 93 bien sûr, et les autres basés pour espace building il du port, et vous capable aussi envoyer un email aussi, et les autres le website aussi quand vous capable gagner plus d'informations les autres bons services qu'ils ont donné. Alors je me répète numéro 432 66 93. So Dr. Prithivi, thank you.
Thank you very much.
And have a wonderful day.
Thank you.